Hi, today we are here with another role play. The role play is about a 31-year-old marketing director who's having an excruciating headache. Now the patient has to go for an urgent meeting, so he has come to an accident and emergency department to get a painkiller. So we'll see how it goes.
Okay.
All right, we'll start the role play.
Okay.
So your time starts now.
Yes. Good morning.
Good morning.
My name is Tina Thomas, and I'm a registered nurse working in this accident and emergency center. What brings you here today?
Oh, I'm suffering from severe headache.
Uh-huh.
I need some painkillers.
Okay, don't worry, you relax. Could you please tell me your name?
Yes, my name is Peter.
Peter. How can I address you?
You can call me Peter.
Okay, yes, Peter. So, Peter, you came here with severe headache.
Yes.
And you told me that you want a medicine, right?
Yes.
Okay, so abruptly, I won't be able to give you a medicine, but I would need to know more about your headache so that I will know what type of medicine to give you. If it doesn't mind, can I ask you some questions in detail?
Okay, go ahead.
Okay, so as you told me you are having headache, I would like to know from when did this headache start?
I think it's about, it started 2 weeks back.
2 weeks back. In a day, how many times does it come?
Well, I was getting headache twice in a week.
Okay, and do you have any severity in your headache?
Oh, it's really severe.
Okay, okay.
I won't be able to even concentrate on my work when I get headache.
Okay, could you please describe your pain?
Well, it is on the right side of my forehead.
Okay.
And it's almost till the
Ear.
ear. Sometimes I feel pain on my ear.
Oh, ear also. Okay, and do you have any other symptoms that is associated with this pain? I'll
Yes,
give you some example. Maybe some vomiting or blurred vision or any tingling sensation, anything like
Yes,
that.
I was getting nausea and dizziness.
Okay. And do you feel anything is triggering you for having this headache?
Well, what I found was that when I'm concentrating, when I'm looking on the computer screen, the intensity is getting much more.
Okay, so I understand that. So you're telling me that you started having this headache 2 weeks back.
Yes.
It's on and off. At least in a day you get twice. You have nausea and vomiting.
Yes.
And then you said when you look into the computer screen and when you see the rays of sun, this is how you are getting headache, right?
Yes.
Yes. Is there anything else that you would like to add?
Nothing. I just need a medicine now because I have to go for a meeting.
Certainly, I do understand, and I know that you are very busy. Could you please tell me what type of work do you do?
I'm a marketing director.
Marketing director. Okay. So thank you for answering to all my questions. I have one more last question to ask you. Now, if I'm going to show you a pain scale where 0 is the least pain and 10 is the worst, where would you rate your pain?
I would say 10 because I've never
Okay.
experienced such a severe pain in my life.
Okay, I'm so sorry to hear that you're going through severe pain. So before, like you said, you were having this pain past 2 weeks, right? So how were you managing with this pain? What were you doing?
Oh, I might take a nap for 2 hours or something, or
Okay.
might take a painkiller.
Painkiller? Okay, fine. So from all what you said, what I understood is it's a preliminary diagnosis. It's not confirmed. What I suspect is you are having migraine.
Migraine?
Yeah.
Oh,
Okay.
I never thought that I'll get migraine.
Migraine. So it's not a big issue because the word sounds a little bit scary, but it is just a type of headache. Okay. So as
how
you
can we treat it?
you have medicines to treat. You can do a lot of relaxation techniques, yoga, meditation. There's a lot of things for migraine, and then you need to take some amount of
Okay,
medicines
so
also.
now can you give me the medicine because I'm getting really late.
I know you are having a meeting very soon that's coming up. The thing is, you can only see that you have to see the doctor Without seeing the doctor, I won't be able to give you any medicine.
Okay, then where's the doctor? I'll go and see him.
Yeah, and that's the thing. That's what I was about to tell you now. The doctor will take around 30 minutes delay because
30 minutes?
Yes.
Oh, sorry, I can't wait for 30 minutes. I have to go.
The thing is, understand, Peter. The thing is, the doctor is actually in a rounds and he's attending a serious case. Within 30 minutes, he'll come back.
But see, my meeting is in 45 minutes.
45
if I wait
minutes.
here for 30 minutes, I will get late for the meeting. I have to go.
I do understand that, and I really respect your situation. I really understand your time. I know you're a very busy person because when you came here, as you told me a lot of problems that you're going through, and as I understood from you all what you're going through, I know that you're having a severe headache. Having so much of headache and going for work is not good for your body. It will, try to harm your body in one or the other way. Okay, I'm not trying to scare you, but I'm just telling you the reality. But if you could just wait for 30 minutes, the doctor will come and he'll definitely will give you a good medicine so that your headache will be going. Is that fine?
All right, I will wait for 30 minutes, but not more than that.
Okay, so I'm so happy to hear that you'll be waiting to see the doctor, and thank you for having so much of patience to listen to my talk and trying to able to understand that. But once again, Peter, let me tell you, don't worry, you have come at the right place, and we'll be providing you the best management and the treatment so that your headache will be reduced. Okay?
Okay.
Thank you.
Thank you.
Okay. Finally, we are here with our explanation session, right?
Yes.
Okay, so here there are certain things that you need to understand. That is especially when we are going to ask questions related to pain. So here Georgina said that she's having pain. So just think about it. When it comes to pain, there are a lot of questions you can ask related to pain, because in your task also is written so many things have been listed down. So first you need to ask them what type of pain. You have to describe your pain. When does it occur? How occasionally it occurs? And is he facing any symptoms associated with headache? Especially when you have headache, you have even nausea, vomiting, or maybe any blurred vision that's associated with it. Last but not the least, you should even ask regarding what is triggering your headache. Most of the people have. Sometimes when we read a lot, when we watch the phone a lot, when we watch TV a lot, or when we are stressed, we get headaches. So these are some of the situations which make us to have pain. So these are some of the things that you need to ask. And then the way patient is telling, like from 2 weeks or maybe 1 week back, he's having pain, you should ask, what were you doing? What treatment were you taking? Were you taking something to reduce your pain? What were you doing? We can ask that. And then the most important thing is to ask the pain score. Pain score is very, very important. Even if they don't show it in your task, it's good that you ask. Sometimes in the interlocutor's cue card, on the role play card, they will be having something to say. Until and unless you tell, they won't be able to tell you out the side, right? Yes, so that's very important. This is the most important thing in this role play. So pain is a very chronic condition where you need to know what all to ask. So keep all these things in your mind, especially when it comes to a scenario where the patient is having excruciating pain or any sort of pain. Please ask all these questions. This will fetch you good marks because it is gathering information. You are having a rapport building. You are incorporating with the patient. So many criteria you are fulfilling in clinical communication criteria. When you are fulfilling all the criteria in clinical communication criteria, one way your linguistic criteria, inside that also marks are also you're going to get. You will get more than a B score. So try doing all this and you'll get good marks. Okay.